Apologies for our late delay tonight. Cancer Council in New South Wales acknowledges the traditional custodians, both past and present, of the lands on which we live and work. Welcome to you all. My name is Jill Mills, and tonight we will be talking about the benefits of exercise in the context of cancer. So just a little bit of housekeeping. If you have any technical problems, there's a number in the chat box you'll see there, 1800 733 416. Call that number and they will sort you out. So we encourage you to use the chat box tonight, chat to each other, ask any questions. We had about 100 or so questions received with the registration, so we can't address all of them, but we've looked at different themes. Any specific medical questions we can't cover here tonight, that sort of thing you really need to consult with your GP or your oncologist, specialists, treating specialists, people like that. So also, if you feel you get distracted by the chat box, don't worry about that. We will send a recording out to you. You can watch it all again later. So at any stage, if you need to speak to anybody urgently, if anything comes up for you, you can ring a Lifeline counsellor on 13 11 14, which is available 24/7. So let's get started. Firstly, I would like to introduce our panel. Next to me, I've got Cherie, Jeanette and Prue. So we've got Lauren in the chat box. So hi, Lauren. She'll answer any of your questions that you might have and help you along the way. So please say hello to her. So we'll get started. Cherie is going to tell you a little bit about her story. So we'll click the first slide. And there we go. There you go. Over to you.
Thanks,
You're
Jill.
in control of the mouse now. So
Okay.
just make sure we get it in the right spot.
Hello everybody, I hope you're all well out there, and hopefully my journey or the story of my journey will be comforting to some of you and be interesting. Before I was diagnosed with bowel cancer, I'd always been interested in healthy eating and always exercised. In fact, I didn't really fit the usual indicators for bowel cancer. It was genetic. My dad passed away 22 years ago, and he had exactly the same cancer, and he was 62 and I was 61, so it was all a little bit scary. And then 9 months after I was diagnosed, my brother was diagnosed with bowel cancer and he had surgery. I've always been really active and I basically walk everywhere. It's good for the environment, it's good for your health. And my diet's always been vegetarian, low in saturated fats and low in sugar, and I've always been conscious of what I eat. And we grow our own veggies as well. Before I was diagnosed, I'd never really been ill. In fact, I hardly even had a cold. So to be admitted by emergency was a bit of a shock, as was the diagnosis. I didn't even think that that would be possible. Following the surgery...
Oh, I can click for you if you like.
I'll forget.
That's okay.
Following the surgery, the surgeon said that he'd removed part of my colon and 64 lymph nodes, 4 of which showed signs of cancer. This meant that I had to undergo chemotherapy. Whilst I was waiting for my first chemotherapy, I saw an advert for the Challenge program, and it was run by Professor Vardy at a Concord hospital and the Survivor Centre. And Jane Turner was the exercise physiologist and her contact details were there. So I wrote Jane's name down and the number because in my mind that's where I wanted to go. My intentions were to be part of that program because I wanted to get well. I had too much to do and I had a good family to live for. I knew the road ahead might be tough, but I also knew that I'd get through it. Towards the end of the second out of 8 cycles of chemo, I ended up back in hospital for 15 days. My weight plummeted, I couldn't eat, I had no energy, my body was basically shutting down and I felt dreadful. And to make things worse, most of my family lived on the mid-north coast. Sorry if I get a bit emotional, but my mum was recovering from a hip replacement she had the day after my surgery, and she had also just been diagnosed with dementia. Things weren't good. I felt alone and depressed, often thinking I would not survive. I wasn't giving in though. I'd always been pretty positive, so I did what I had to. When I felt well enough, I got up out of the hospital bed, and every day I tried to do a bit more walking because I was determined to get out of hospital, and I did. The oncologist adjusted my medication, and after a short while I was able to go back to work. I'd always walk to and from work, which is probably about 6-7 k's a day. So I started off catching the train one way and walking home until I got fit enough and I felt better, and I walked back to work and home again. During this time I gradually built up walking on weekends. I had a healthy diet and I felt grateful for every day. I'd heard many people say that when you have a serious illness, it really makes you appreciate life, and it does. I try to practice mindfulness every day. I wake up every day grateful to be alive and make every day worthwhile. Finally, the chemo was over and I could start getting my life back on track. My inspiration and gratitude, I think about being grateful every single day I wake up. First and foremost, the inspiration to get well was my family and my good friends. I'm blessed to have a wonderful family and the best bunch of friends you could ask for. They're very important. My surgeon, oncologist, nurses Jane and Professor Vardy, I really don't want to let them down. They're my inspiration. They've all been magnificent and I've received wonderful support and care, and I don't want to waste their time and their effort. I really appreciate everything they do and they inspire me medically and humanely. Positivity inspires me, and it feels good to have a more positive outlook in life and just be happy. Exercise inspires me to get out of bed every day. Even in the recent cold mornings, I know once I'm up and exercising, I'll quickly warm up and I'll feel amazing when I'm finished. Focusing on this post-exercise feeling is my motivation to get up and get going. Physically getting stronger and mentally in a better place from exercise is another inspiration. All-round well-being from exercise inspires me. Exercise not only feels good, it's beneficial for so many things, particularly as you get older. Bone density, lowering cholesterol, flexibility, socialising, strength, heart, and also been known to help with things like Alzheimer's and keeping your brain healthy. Exercise and its benefits. As I said, I've always been interested in healthy eating and fitness. However, surgery and chemo really took a lot out of me. I never ever thought that I would be able to be fit again or enjoy exercise again. During my chemo treatment, my oncologist mentioned the Challenge Research Program and he knew I was keen to participate. So when I was in a good place physically, he organised for Jane to come and talk to me about the program. I signed up straight away and I haven't looked back. Jane's the best inspiration you could ever have. She's a great sense of humour, extremely knowledgeable and welcomes everyone no matter what level of fitness they have. Everyone at the Survivor Centre loves her. Day to day, I love getting up early every morning, and I usually get up at 6:15, 6:30, even when it's cold, because I know that once I'm up, dressed, on that walk, I'm going to feel great. I spend 2 weeks out of every month in the mid-north coast where my mum lives, and I do a walk along the beach every day. I watch the beautiful sunrise, but most of all, I love going to the Survivor Centre gym. Everyone's positive and they've all had the same experience with cancer. We all want to get well and stay well. Jane put together a tailored weight program and I do that at the gym, and at home I also do a modified version every night. Exercise has not only improved my physical health, it's also helped my general well-being, particularly depression. I used to have problems falling asleep at night. I was worried I wouldn't wake up. Now I sleep well, wake up every day grateful. In fact, it's a strange thing to say, but since I've been diagnosed with colon cancer and recovered, I'm the happiest I've ever been in my life. My outlook on life has certainly changed. I don't sweat the small stuff, and I look forward to enjoying life and the company of my 4 beautiful nieces. My personal best was recently the Cooks River Fun Run. They also had a 5-kilometre walk. I've never really been competitive, but I find now I compete against myself, always striving for a personal best and stretching myself. I've also found since starting Challenge, I love to encourage other people, particularly friends who are unfit or smoke. I love seeing people get fit and I love encouraging others. I feel like regular exercise has given me lots more energy and positivity. Never ever give up is my motto. I'm now a lot more physically stronger and even started some running. I recently completed the kilometre Cooks River fun run and came across the line first in just under 35 minutes. And now looking forward to doing the 27 kilometre Seven Bridges walk in October with a friend of mine's 11-year-old twin boys. So that'll be a challenge. My main focus now is, I think, giving something back's important, and hopefully I can do this by participating in the challenge research and inspiring others to do the same. It may not help me, but it may help others in research in the future. The whole journey seems like a blur to me now, and I try to not focus on the past and not too far in the future. My main focus now is continuing to exercise, challenge myself, and focus on the present. That's why it's called the present. It's a gift. Thank you, everyone.
Thank you so much. That was lovely. Now, one of the ladies, Pamela P, asked, how long ago were you diagnosed?
16th of December 2015.
Okay, so not that long ago, really.
Not really.
No.
And I finished chemo in September in 2016. So it's not too long now. I think I've been on the challenge for about 7 or 8 months.
Great. Thank you so much for sharing your story.
That's
it was
okay.
Great. It's good to hear, what's happening.
It's a great inspiration.
Yeah, absolutely. So I'll just click through now. So I'm going to hand over to Jeanette and I'll hand you the mouse.
Thank you.
It works good on white paper, so yeah. You just click on the slide itself to move forward. Yeah.
So it's a pleasure to be here.
Thanks, Jeanette.
What I'd like to start with is letting you know that there's Australian and international guidelines for how much exercise cancer survivors should be doing. And what they recommend is a minimum of 2.5 hours per week of moderate intensity exercise with 2 or 3 sessions of resistance exercise and avoiding inactivity. So why is this important? Well, the general public don't exercise as much as they should, and cancer survivors probably exercise even less. So what you can see by this graph is that even people that have been quite into exercise prior to their diagnosis, during treatment, that falls off significantly. But the big concern is that it never, in most people, comes back to even what it was pre their cancer diagnosis. So why should we exercise? Well, there's a lot of evidence that tells us that people that are overweight or that are physically inactive have a higher risk of developing a cancer in the first place. So what if you've already got cancer? Well, we know that even for those that have completed their treatment for early stage disease and have no evidence of a cancer recurrence, that compared to the general population, there's higher risks of cardiovascular disease, high blood pressure, diabetes, and osteoporosis. And there's very good evidence that all of those can be reduced by physical activity. But I'm also going to lead you through some evidence that strongly suggests that exercise could also decrease the risk of either a cancer recurrence or a new cancer. So this is based on a large series of a number of observational studies. So an observational study is one where generally large groups of people, in this case that have previously had cancer, are followed long term, and they complete quite regularly looking to see what's happened with their disease, and also one of the questions is how much exercise they're doing. So this is called a meta-analysis, where they combined data from 20 of these studies, and half of them were in women that had had breast cancer. And 3/4 of the study showed that if you were able to increase your physical activity, that was associated with being able to decrease not just an earlier death from any cause, such as a heart attack or a stroke, but actually able to decrease death from the cancer. And the amount of that risk reduction was really large. So it ranged from 15% to 67%. And we saw what's called a dose response. So this means that a little bit of exercise is better than none, but a lot is better than a minimal amount, and that dose response was seen in just over half of the studies. So we don't yet know what the sort of minimum amount, if you like, is, or exactly what that exercise should be. So if you're into data, let me lead you through these next few slides. So this is called a forest plot, and what you can see is that there's two graphs, one here on the right, which is looking at a hazard ratio from dying from any cause, so a heart attack or getting hit by a bus, and then this was in women with breast cancer. This is specific here for breast cancer. And the hazard ratio of 1, so if these dots were falling on the 1, that would mean that there's no real benefit to exercise. And what we want to see is where these dots, which is the average, if you like, risk reduction, is all to the left of these lines. And you can see that it basically is for each of the studies. And not only is it improved for the general cause of death from anything, but specifically for the breast cancer. And the other important take-home message from this is that they looked at how much exercise people were doing before their diagnosis, and whilst that's important and that helped to decrease the risk of the cancer recurrence, the really good news for you out there is that what was really important is how much people exercise they do after their cancer diagnosis. And similar results were found for non-breast cancer studies, which were mainly in bowel cancer and also in prostate cancer. And again, we're looking to see how many of these are on the left-hand side of this dotted line, and you'll see that in particular, there's a really great benefit for exercising after diagnosis. So it's not too late. This graph is looking at survival after breast cancer, depending on the amount of exercise that people do. And this was taken from a really large study that was following nurses. And over a period of years, about 3,000 of the nurses developed breast cancer, and they looked at how much exercise they were doing. So not surprisingly, those that exercised more had decreased earlier death. And along here, the x-axis is increasing amount of exercise. But what's really important is that the women who were exercising more were able to decrease their risk of cancer recurrence and dying from cancer by almost half if they were following the guidelines that I posted up there for you earlier. And just to show it's not just breast cancer, but this is Australian data where we look at how many people were alive at 5 years, and we find 73% of those that exercise compared to 61% of those that don't exercise. And these studies have adjusted for things like increased weight, whether the person smokes, stage of disease. But they are what we call observational studies. So they're just following people up long term. And instead, what we now need to really prove this is randomised control study. And I'll talk more about that in a moment. But just to stress, it's not all just about can we live longer, but there's other really important things that there's a lot of evidence showing that people that exercise that have had a cancer diagnosis are able to either maintain or often improve things like their muscle mass, their strength, improve cardiorespiratory fitness, their physical function, range of motion. So, for example, if they've had an axillary node dissection, able to maintain shoulder and arm movement, and importantly, decrease risk of infection in the exercises, and they're able to complete more of the desired amount of chemotherapy and improvement in body image, self-esteem, and mood. And importantly, they also have a decrease in the symptoms and the side effects associated either from the cancer or from the cancer treatment. So, for example, fatigue is the biggest symptom that people at any stage of cancer report, and this can be sustained years after their diagnosis and treatment. And exercise is by far been proven to have the best benefit for helping fatigue. There's also a decrease in the severity of the symptoms reported. Exercisers have less time spent in hospital, less stress, and less depression and anxiety. So all around, it's something that we would really strongly recommend, and at any stage of the cancer journey, be it from when someone's first diagnosed, and say, for example, awaiting surgery, whilst you're on treatment, including whilst you're on chemotherapy. For those that have completed their treatment, and in particular to prevent long-term side effects and to facilitate a healthy lifestyle. And even for people that have quite advanced disease, it's been shown that this can help to maintain their function for longer and to decrease the symptoms. So Sherry has already actually given a really nice little introduction into challenge. So this is the randomised control that we need to have to really prove once for all whether exercise can decrease the risk of a cancer coming back for patients with colon cancer. So this is a study that we're doing together in collaboration with the Canadian Cancer Trials Group. And we're very ambitious. We need 1,000 patients, and we're looking to see whether patients are able to undergo a 3-year structured exercise program, and whether that can improve their, to decrease the risk of the cancer coming back. So to do that, they're randomised. That means they don't get a choice, we don't get a choice, it's done by computer, to either a group of patients where everybody gets some health materials supporting the evidence for exercise, similar to what you're getting today, but in printed format, and then the other group get randomised to having a 3-year structured exercise program. So this is for people that have had early stage colon cancer and who have completed their chemotherapy within the last 2 to 6 months, who aren't currently meeting exercise programs, but for whom there's no medical reason why they can't begin to exercise, even if they've never exercised before. And for those randomised to the exercise program, there's 2 main components. One is the actual supervised exercise sessions, which start at least fortnightly to begin with, and then decrease as people are able to do more and more by themselves at home. But importantly are also these behaviour support sessions, so teaching people about why exercise is so important and how to make it part of their ordinary life. So we've now randomised 60% of the patients that we need for this study, but we're still looking at over 300 still to go, and Australia's randomised 200 of those patients. And if you're interested and you think you may be eligible, I've put there the name of our coordinator, Shelley, and contact details for her. And on this page, I've included the actual Australian sites where this study is open. So it's not just at Concord, but it's in 5 states throughout Australia. So another study that I'd like to commend to you, and this is for people that are living in New South Wales, Victoria, South Australia, and WA, is a study that's being done, led by Liz Eakin in Queensland, but that's being done in conjunction with the cancer councils in each of those states. And this is looking to see whether a telephone-delivered intervention can help cancer survivors. So basically, this is not a randomised trial. Everyone who is able to join gets the intervention, which is a health coach, which is run through the Cancer Council. So fortnightly coaching sessions over 6 months, and looking at not just physical activity, but healthy eating and, if appropriate, weight control. So this is for patients with any localised cancer, who have completed their primary cancer treatment, and by that I mean chemotherapy, surgery, radiotherapy if those are required, within the past 5 years. And the preliminary results are promising, with some weight loss, increase in exercise, and improved quality of life and decreased symptoms overall for the participants. This is just a snapshot of what the web page is. So if you go on to Cancer Council in your state, if yours is one of those states involved, and you'll be able to find the details there. And finally, there's the lifestyle intervention called Enrich, which we're also involved at Concord, and this is run through the Cancer Council, and it's a 6-week program, 2 hours a week, group sessions. This is for patients at quite diverse stages of their cancer treatment, and it's led by a dietitian and an exercise physiologist. So the focus is on making healthier food choices and also practical exercise sessions. So this is my take-home message. To get a healthy lifestyle, we need healthy eating, but we also need to be physically active. And this cartoon, this is something patients, as a medical oncologist, I'm asked frequently. Now, how can I, by either the patient or for their family, what can we do to improve our health? And if I was able to bottle this and charge for it, I would be a multimillionaire. But the thing is that it comes with lots and lots of benefits, both for cancer patients but also non-cancer patients, and best of all, it's free. So I would strongly recommend getting into exercise. Thank you.
So just a couple of questions before we move on. So Helen M was asking about, she has neuroendocrine tumours and ongoing. So she's saying, what about chronic cancer and exercise? So I guess, you know, what can she do?
So there's so things like the Enrich study would certainly be suitable for her. There's no reason why people with a chronic cancer aren't able to exercise. I think the really important thing for anyone, and I'm sure Prue is better qualified than me for this, but it's a matter of starting gradually and building it up.
Yeah.
And so particularly for people with more advanced disease, it's a matter of getting the right help to really be able to start it. But the best thing probably to start with is just walking, and then increasing the speed of the walking. So patients will say to me, oh yeah, I go shopping every week. So I say, no, sorry, that doesn't cut it. You know, window shopping, you need to be walking fast enough so if someone saw you walking, they'd say, oh, that person's running late for an appointment. We need to get the heart rate up. But start gradually and build it up.
And then there was another one about gentle Tai Chi, and I think, again, Prue's probably going to touch on this. Raywin G, twice a week she does it, 45 minutes.
Fantastic.
Is that a desired component of the exercise requirements, or should she be doing more?
So I'd say the Tai Chi, or we also do Qigong at Concord, is great, the breathing and the stretching and everything else. But I'd also like to be seeing some aerobic exercise that's going to get the heart rate up. But again, I think Prue's better qualified to speak to that than me.
Thanks, Jeanette. That was great.
You're welcome.
And hand over to Prue now. Thank you, Prue.
Thank you so much. So my name is Prue Cormier. I'm an exercise physiologist. I work down in Melbourne, actually, at Australian Catholic University, and it's really wonderful to be here today with Cancer Council New South Wales and the ladies here to hear your story. Sherry, was fabulous and great to hear about the research going on, Jeanette. So it's really wonderful to be here, and what I wanted to do with the time that I have is really talk a little bit more about the practicalities of exercise and how you guys can actually realise the benefits that Jeanette has been talking about and that Sherry has experienced. So feel free to ask any questions you like, and there's also my contact details up there. You can always reach out and chat to us if you have more questions offline. So I think just to summarise what Jeanette said, you know, why should you exercise? And if we put everything together about what we know from the scientific literature, we can confidently say that based on everything that the science tells us, exercise offers the greatest potential as an additional therapy or medicine to reverse treatment-related side effects, to help increase your well-being, quality of life, and could potentially even extend survival following a cancer diagnosis. Jeanette touched on some of the side effects that exercise has established efficacy in counteracting. Things like physical deconditioning, fatigue, psychological distress, unfavourable changes to body composition. We know that exercise can help to counteract these things. Exercise can help improve your physical well-being, can help improve your mental well-being, and can also interact with your social well-being. And there's some really good evidence, and it's only suggestive at this stage, but some growing body of evidence to suggest that exercise is associated with low relative risk of cancer-specific death, of cancer recurrence or cancer coming back, and also of dying from any cause. So when we put all this together, we really see that exercise is a medicine. And if the effects of exercise could be encapsulated in a pill, it would undoubtedly be the most widely prescribed medication in the world. And even if this pill had just a fraction of the positive health benefits that regular exercise provides, it would be given to every single patient with cancer. Now, the reason that exercise can do this, it's one intervention that has a lot of benefits. And the reason that exercise can do this is because it's a really potent way to positively influence all the body systems at the same time. So exercise positively impacts the structure and the function of virtually all the body systems. So it helps the heart and the blood vessels function effectively. It helps your lungs transport oxygen to all your muscles. It helps build your muscles and strengthen your bones. It helps regulate your metabolism and your hormones, which really communicate to a lot of the functions that happen within your body. It helps your brain communicate to your body and understand how and when you should move. And it also helps enhance your immune system, allows your body to fight off infection and indeed diseases such as cancer and other chronic conditions. So exercise is a very effective medicine. Now, when we actually think about putting exercise medicine into practice, what does this look like? What does an exercise prescription mean? Jeanette touched on the evidence-based guidelines, and this is what we know from an extensive body of scientific literature, that to realise the therapeutic effects of exercise, so to get significant health benefits, we need to be achieving 150 minutes of moderate intensity aerobic exercise each week, and in addition to this, 2 to 3 resistance exercise sessions that are performed at a moderate intensity. Now, basically what this means, there's some funny numbers there, but 150 minutes equates to a 30-minute brisk walk on 5 days a week. And 2 to 3 resistance exercise sessions really means doing weight-bearing activities, lifting weights, using the large muscle groups, going across multiple joints in your body, usually 2 to 3 gym sessions that are about 30 to 45 minutes each week. Now, a key element to actually achieving these health benefits is the intensity of the exercise or the quality of the exercise that you're actually doing. So you'll notice here it's a moderate intensity. And what does that mean? So it means that when you're doing these exercises that you can't just go shopping, window shopping, you actually have to be walking at a brisk pace. As Jeanette said, walking as if you're late for a meeting. Or this could be riding a bike or swimming or jogging, whatever it may be. The key thing is you want to feel that your heartbeat is increased, your breathing rate, you're puffing, you're increasing your body temperature, so you're sweating a little bit. And if I asked you how hard you were working, you would perceive the difficulty of that exercise as being between somewhat hard to hard. Now, it's really important that we focus on the intensity, because what we see from the science is that the better quality exercise that you do, so the higher the intensity of the exercise that you do, the more benefits you gain. So it's really important that it's thinking about not just doing exercise, but doing exercise well. Now, a key component to this, for a lot of people, you probably look at this and you think, how on earth could I possibly achieve this? It's so much exercise. But what we do in terms of delivering this is we gradually build up, as Jeanette said. This is individually tailored, so it's specific to your health condition, your current status, what treatments you've been going through, what kind of symptoms you're experiencing, and then it's progressed steadily, so we increase this and work towards the ultimate goal of achieving these guidelines. Now, what we do, and we're moving beyond these guidelines to really push forward in terms of enhancing the potential of exercise to help manage the side effects that you experience going through cancer and cancer treatments by incorporating targeted exercises that are specific to the type of cancer you have, the stage of cancer that you're diagnosed with, what kind of treatments you've gone through, what your current health status is, and what kind of side effects you're experiencing. So I'm sorry the video can't play here, but what this is an example of how we use exercise in a different way. So we get gentlemen with prostate cancer who are undergoing hormone therapy or androgen deprivation therapy. We actually get them to jump over little hurdles, we get them to skip, we get them to hop and leap. And the reason that we do this is that the treatment of the hormone therapy involved with prostate cancer really accelerates the loss of bone mineral density, or the quality of the bone that these guys experience. So we're doing a very sophisticated type of exercise prescription based on trying to counteract that very specific side effect. And we can do this with all sorts of different kinds of cancers and different kinds of side effects. But it very much is about trying to tailor the exercise prescription so it's specific to you and the treatments that you're going through. Now, the key message here is, as much as possible, and even if you can't work to achieving these ideal levels, just keep in mind that avoiding inactivity, even when you're undergoing very difficult treatments and even when you're experiencing really difficult side effects and extensive fatigue, as much as you possibly can to try and avoid inactivity. And to keep in mind that, generally speaking, some exercise is better than none, and generally more exercise is better than less. And if I can just add to that, the quality of the exercise is really important. So higher quality exercise gives you the best benefits. So higher intensity, better benefits. And this is generally speaking as well. So how do you actually try and achieve this? What can you do to get into this kind of high quality exercise? Well, you need to see a health specialist. You need to see the most appropriate health professional to try and provide the advice and prescription that you need specific to your cancer. And that health professional is an accredited exercise physiologist. So accredited exercise physiologists are university qualified allied health professionals recognised through Medicare and a number of other organisations as the most appropriate health professional to work with chronic conditions and to deliver exercise over a long period of time. So as an exercise physiologist, I use exercise as a medicine to help manage disease and improve well-being. And to realise the significant health benefits of exercise, we use very targeted exercise prescriptions based on a change that we want to achieve within our body. So by understanding what happens inside our bodies when we exercise, an exercise physiologist can prescribe exercise in much the same way that any doctor prescribes a medication. So we use specific types of exercises at precise intensities and volumes based on a certain physiological change or a mechanism of action and a dosage and amount of that exercise required to make some sort of physiological change, whether it's, as you saw with the men with prostate cancer, trying to slow the loss of bone. Now, accredited exercise physiologists, there's over 4,000 practicing in Australia, most of which are based in the community, and you can find an exercise physiologist by going online to the website here, www.essa.org.au. You can click onto the button that says Find an EP near you, pop in your postcode, and it'll come up with a range of different exercise physiologists that are close to you. Now, exercise physiologists are qualified. They go through university, they have extensive continuing professional education requirements, but if you really want to maximise the safety and the effectiveness of your exercise prescription, you want to be seeing someone who has specialised expertise in working with people with cancer. Now, in order to do that, our team has been working on key educational programs, professional development courses that allows for exercise physiologists to learn about the latest scientific evidence and best practice, clinical practice in delivering exercise to people with cancer. So I can give you a website later on in the webinar that shows, that basically gives you a list of exercise physiologists based on states that have gone through and completed this additional education. So it's key people that have provided or have gone through education to really hone their skills and maximise the ability to work with you safely and to maximise the efficacy of that exercise prescription. So a big question here is, wait, hold on a second, if I'm going to see an exercise physiologist, won't that be really expensive, especially if it's someone with specialised expertise? Well, there is a cost with seeing an exercise physiologist, just like any other health professional. But exercise physiologists do have subsidised services through Medicare. And you can access these subsidies through talking to your general practitioner about a chronic disease management plan. Through the chronic disease management plan, you could be eligible to up to 5 visits with an accredited exercise physiologist, and they can be individual visits. And the out-of-pocket cost for something like that may be as low as around $10, or it might even be completely subsidised depending on who you're seeing. Now, in addition to that, there's over 30 private health insurers that now provide subsidies for exercise physiology services. And those subsidies are not only just about individual sessions, but also about group exercise sessions. And generally speaking, if you're being involved in a program, in a group service, it costs around $10 to $20 per session. Now, this is a cost, and it is an additional cost. I would say that you would pay more for a plumber to fix your toilet than it would be to go and see an exercise physiologist to fix your body. So thinking about that cost as an investment, and an investment that brings about other benefits. So it improves not only the ability to counteract the side effects of the treatment and the cancer itself, but it also improves your overall well-being. It can help manage any kind of comorbid or chronic diseases or other health issues that you may be experiencing. And it may help kickstart some other health enhancing behaviours, such as improving your diet, helping to lower your alcohol intake, and also helping to quit smoking. So I think when you think about the investment and the potential benefits that you get out of exercise, it really probably is the best insurance policy you can invest in. I think another thing that a lot of patients ask is, okay, well, if I go and see an exercise physiologist and I'm working towards these guidelines, will I actually be able to comply? Could I do that prescription? And what we see from working with thousands of cancer patients, both during treatment, recovering from treatment, and a long time after treatment, is yes, absolutely. When the exercise is prescribed and monitored in an appropriate way for you, in an individualised way, the compliance rates in achieving those evidence-based guidelines are very high. So 80 to 90% of people, or 80 to 90% will attend those, will attain that 150 minutes and the 2 to 3 resistance exercise sessions, and can maintain that over a period of time of 6 months with a very small discontinuation rate. Now, when you compare that to the ability to take drugs, medications for high blood pressure or depression, exercise really stacks up quite well. So even though it seems very scary in the first place, I would encourage you to, after you see an exercise physiologist, realise that you absolutely can comply with this prescription. And even though it seems a little bit scary initially, you can work towards getting there. I think a key question now is how do you get started? And my best advice would be to go and see an exercise physiologist. And if you don't know who to see, reach out to the Cancer Council in New South Wales, talk to your GP, talk to your specialist, talk to your nurse, and ask them to refer you to an exercise physiologist who has an interest and expertise in working with cancer patients. The Cancer Council New South Wales has a really fantastic suite of resources, amazing people working in this space that can really provide a lot of valuable information about how you can get started. And, aside from that, just remember to avoid inactivity. Pop out and go for a walk. And if you can walk just to the letterbox today, try and walk a little bit further the next day, around the block, around the day after that, and just try and continually progress a little bit further each time. So there's a whole bunch of information, there's videos, there's resources that you can access through our website here in addition to the Cancer Council's website. I did a TED talk recently talking about the role of exercise for people with cancer and how exercise can generate these benefits, and that's available on our website too. So I really encourage you to have a look at the website, and you can start to follow us through social media as well, and we can provide a lot more information through those formats. So thanks very much, and I'm very happy to take any questions.
True. There were quite a few questions rolling through, but as they were coming through, you were kind of answering them as well.
Oh, great.
Which was fantastic, because it's like, you're obviously talking about what people want to hear about. So I think most of them have been covered. There was one about hydrotherapy, a proper hydrotherapy program. Is that counted as sort of resistance exercise?
So not necessarily resistance exercise. Hydrotherapy does involve more resistance, but the key thing about hydrotherapy is it's a great modality to do aerobic exercise to get your heart rate and your lungs, your cardiovascular system really training well without having the impact and the loading of doing these exercises outside the pool. So it can be a fabulous way to get started, especially if you have issues with hips, knees, back and so on. And there's some great programs out there and great specialists who work with the therapy. So yeah, it's definitely a great modality to do, more so for aerobic exercise rather than resistance exercise. When we talk about resistance exercise, it's really lifting weights. So it's working against a resistance that's going to load your muscles and your bones such that they're working hard. So, you know, it's not Arnold Schwarzenegger style kind of lifting ridiculously heavy weights, but it's lifting weights that will generate a response within your muscle. So typically you have to be doing that in a weight-bearing environment, which is not in the pool necessarily and not on a bike, for example. It's usually walking, running, or in the gym lifting weights.
Okay. And you covered about people being scared and how much should I do. I think, you know, they're worried about if I'm not feeling well or I'm feeling fatigued, should I be exercising? Should I be resting? We talked about today having, you know, pain and...
Completely. Yeah. It's a really good question, and it's very difficult. You know, we think, oh, I'm tired, I'm fatigued, or I've got pain, I need to rest, I need to conserve my energy, or I need to let the joint heal, or whatever the soreness is. What we know from really high quality research evidence, the science is telling us that's probably the worst thing you can do. Even if you're feeling really fatigued or you have pain, if you exercise in a well-managed way, so an appropriately prescribed exercise program will help you counteract that fatigue, will energize you, and will help actually manage that pain, reduce the severity of the pain. And even though it seems like a funny thing to say, this is what we know from an extensive amount of research. So on those days when you're feeling fatigued the last thing you want to do is get out of bed, I really encourage you just to try and get up and be as active as you can and rest when you need to and have the intervals in between how much activity you do and how much rest you do.
And I'll reinforce that as well. Yeah, no, I was just going to comment on that. I think it helps with fatigue a lot. And sometimes, I mean, I'm pretty much active all day, but by about 5 o'clock I get a bit tired sometimes. But since exercising more, it's gotten less. So it does really help.
Yeah. And we recently did a webinar about fatigue, and again, one of the things was pacing yourself.
Absolutely.
So it's another one you can go online and have a look at if you're interested. And neuropathy, when all the questions were coming with the registrations, there were a few questions about neuropathy and exercise. Yes. Again, we have done a webinar about that as well. But if you'd like to comment about
the best evidence
and neuropathy.
The best evidence of what can help neuropathy, particularly say people that have had it after oxaliplatin for colorectal, is probably exercise as well. So it may restrict slightly what exercises that you can do, particularly if you can't feel where your feet are in space. But maybe, for example, on an exercise bike, so that's less of an issue, would be a really good form for people where particularly they have the foot neuropathy.
Absolutely. So the best advice there is to see an exercise physiologist, because what they can do is really help manage the specifics of your neuropathies. If you can't grip a weight or hold on to something, or you're having issues with balance, or like you said, there's sensation in your feet, there's ways we can get around that and work around that while still being able to exercise in a way that we know will help. So there's early evidence to suggest that exercise may help manage neuropathies. And certainly from just an anecdotal point of view, we've seen it in our clinics quite extensively, that people can manage neuropathies and do exercise in a way that they can still realise significant health benefits.
And I'll reinforce that as well, because I had problems with my hands and feet and still do, not severe, but it's getting better. But I found that when I do weights at night, by the time I've finished, it's heaps better. And also knitting. I know it's not exercise, but it keeps your hands going. And my feet too. I do balancing exercises at home, and it has really helped.
Yeah.
Good. And there was a question here about yoga, body weight and core. Again, depends on what type of yoga, I guess.
Absolutely. So absolutely, really encourage you to, if yoga is what you love doing and it gets you off the couch and exercising, absolutely do it. And there's some great benefits from yoga. It's not included in the evidence-based guidelines because there's very little research done on yoga. And that's why we don't yet know exactly what the benefits may be and whether or not they should be included in evidence-based guidelines. But I will say any form of activity that keeps you moving is a fabulous thing to do. And just remember, when you want to realise significant health benefits, you really have to be focusing on the quality of that exercise.
And see an EP that's qualified to help you.
Absolutely, that's most definitely. It could just be one conversation. It's just seeing a specialist and one conversation, and they can work with you to be able to formulate a program that's specific to you.
So we might start on the questions, and again, some of them we've kind of covered. But so how much is enough exercise or not enough? So that's the level, and again, it's individualised, I guess, isn't it?
Well, I guess, sorry.
Go ahead.
By the guidelines, I would try and aim for that as a minimum and to go further. Now, there'll be some people that can't do that. So I think it's back to what both of us have said. If a little bit is better than nothing, and more is better still. We don't yet know what the ideal amount is.
Absolutely. And, sometimes, those guidelines, they're lofty numbers as well. When you're going through chemotherapy or really tough treatments, sometimes there's no way in the world you can get out for that volume of exercise. So I think another thing, and just practically speaking, don't try and put yourself in a hole to always do this. Listen to your body, allow your body to respond. As long as you're doing something, and each time that you go out, you're trying to progress that little bit more. I think that's, working towards those evidence-based guidelines is always the key thing, and that's how you're going to get significant health benefits, but keeping in mind that something is better than nothing.
Yeah. So I guess keeping a track of what you're doing, like writing it down so you can, have a journal, I guess.
Some people find that really helpful, or some of the devices
some way of
and things.
Yeah. There's an interesting one, Meredith L. She's got a 19-year-old daughter that's had brain cancer, and again, she wants some help. Like, how can she motivate her 19-year-old daughter, who used to be a cross-country runner and all this sort of thing, and it's harder, I think, when people are younger. So any suggestions for her?
Yeah, the best advice really then is to see an exercise physiologist, because it's really individual. So we know some key things about what can help motivate people to exercise. Certainly understanding why exercise is important and what benefits Meredith's daughter will receive is going to be important. But if you see an exercise physiologist, a specialist who's really working in this area, they'll be able to individualise that advice and work through the specific barriers that Meredith's daughter is experiencing. So that's probably the best way to do that.
And probably to try and enlist the support of other younger friends, for example, so that, and they may need to modify what they're doing. But again, so it's individualising for what she's interested in, which won't necessarily be what mum's interested in,
exactly.
but then enlisting it so that that can really help. And we've found with our challenge study, where we've looked at some interim analyses for that we think the behavioural support sessions are incredibly important. So it's not just enough to say go and exercise, but you need help to incorporate that into your everyday life. And that's probably just as important, if not more important, for a young adult or teenager.
And I think the next question is a tough one. Again, daily lifestyle, so very good segue there from you. Thank you. Mental health, addictions, domestic issues. So I guess for this person, it's a bit of a struggle, like, so, you know,
Well,
I'm not quite sure what to suggest here.
yeah, so we know that exercise as established management therapy for the treatment of clinical depression. So exercise can help manage clinical depression and is really the first line treatment, and that's provided to from Australian guidelines, from international guidelines. So exercise can actually help with the management of mental health conditions. But it comes back to these behavioural elements in terms of how do you incorporate that into your everyday daily lifestyle. So when we talk about behavioural interventions, what does this mean? It means some basic things: setting goals, breaking those goals down into small steps that are achievable, that's specific, planning well. So, what specifically are you going to do? When are you going to do it? How are you going to do it? What happens if it's cold? What happens if it's wet? Who are you going to do it with? What equipment do you need? All those kind of specifics. And then working through some key barriers. So finding time is always the hardest thing, and sometimes there's expense involved. So it's just breaking down all those components really to make sure that it can fit within your daily lifestyle, especially when you're trying to juggle a lot of things.
And so when you were talking before, so about going to the GP, maybe that could be a port of call to start with to get a chronic management plan, to maybe go and see an exercise physiologist or someone else that's appropriate to help at this stage, I guess.
Absolutely. And just remember, it's just a conversation initially. You don't have to commit to anything. Going to your GP and asking to have a referral to an exercise physiologist allows you then to go and have a conversation with someone who is a qualified professional in helping you counteract these barriers and incorporate exercise into your daily lifestyle, so they can individualise that care and that advice so it's specific to you and your circumstance. And it's an hour out of your day that then you can decide what you do from there, really.
And I was thinking with as you had up on the screen, $10 to $12 is what you pay, and that could be a few cups of coffee.
Yeah.
Let's face it. So
absolutely.
It's like, I guess you have to get your priorities on that one there. So exercise that should be avoided or put to the bottom of the list. Are there any things that people should be wary of? Maybe you're not going to go to an exercise physiologist, you're just maybe going to go to your local gym or try and do things yourself. So what are the things to maybe look out for that could be, not beneficial in some instances?
I think the important thing is just to start gradually. So particularly if you've got fatigue still from your cancer or you have more advanced disease, if you just, really get stuck into it too hard to begin with, for your 2 steps forward, you may end up taking 3 or 4 steps back. So it's a matter of starting gradually. For people that are less mobile or haven't done exercise before, I usually suggest that they start with walking and build up from that. So I think it's more about gradual build up.
So there are what we call, I suppose, in the industry is contraindications. So there's health conditions and situations which would mean that we wouldn't exercise with you, and we do maybe some checks on your health first before we do exercise. So again, that it's hard to answer this without the specifics of the individual, but I would see an exercise physiologist for that. If you have complex health history, if you have chronic diseases such as diabetes or cardiovascular disease that you're managing well or you're not particularly managing well, I think having a conversation with your GP, having a conversation with the exercise physiologist is the best approach to do there. And there are some key things. For example, if somebody has, if you have urinary incontinence, if you leak secondary to any kind of radiotherapy to the pelvis or surgery, for example, prostate cancer surgery, we wouldn't be doing any jumping or running or things like that. So not that there's anything wrong with that, but it's probably something that's pretty uncomfortable. People whose cancers spread to their bones are more fragile, so we're very careful and cautious around the exercise that we do there. So yeah, there definitely are some situations that we need to be a bit careful with the exercise. But as Jeanette said, if people are generally well, walking you can do straight away, and you can just gradually progress and just listen to your body and how you respond. If you have any concerns whatsoever, go and see your GP.
Yeah. And I guess on the flip side, the best types and amounts, which I think we've probably talked about that enough, I think.
Yeah. So I will say, even though we're talking about the evidence-based guidelines, the best type of exercise is anything that's going to get you exercising. Whatever it is that gets you off the couch, do that, and then
it could even be dancing.
Oh, absolutely. There's so many. And just remember that it's avoiding inactivity. Anything that can keep you active is going to be beneficial for you.
Yeah. And your mental health as well.
Yeah.
We've covered incidental exercise. It doesn't count.
Well, some of those would, like gardening and things.
Would they? Okay.
Like, again, it's being active.
Yeah.
But it's not, what we want is stuff that will get the heart rate up.
Yeah. I guess it depends on what type of gardening.
Yes.
Yeah. So I think we've sort of covered most of questions. I hope we've covered everyone's questions that have come up. I need the mouse because we need to go to the next slide. That's all right. So thanks, everybody. I know we started a little late. I'm not sure exactly what time, but it was probably about 10 past, I think. So our hour is nearly up. So again, we talked about Cancer Council 13 11 20. So if you've got any questions, feel free to call tomorrow and ask us any advice that you might need. We also have a new online forum, Cancer Council Online Community, which is a place you can go to and just chat and meet up with other people. And again, Lifeline 13 11 14 if anything's come up and you would like to speak to anybody about it. So thank you to the panel for coming along tonight. It's been great and very interesting, and looking at the chat box, everybody's like, this is great information. I've never heard a lot of this before, so it's really wonderful to hear that feedback. I think it's been really good.
Hopefully in a couple of years' time they'll all come back and say, yes, all of my doctors have told me about the importance of exercise.
That special magic pill. One of the ladies said earlier, I'll have one of those pills.
Well, it's funny you should say that. My GP said that to me. I should be more like you. I don't know how you got bowel cancer, because she sees me walking around everywhere.
Yeah. So as we said, the webinar is recorded and we will email out a copy to you. And also the resources and links and things that Prue and Jeanette's been talking about, we'll share that with you in a document so you can just click through and have a look at everything. So I guess that's it. Thank you all so much. Someone's saying adopt or foster a dog. That's
great idea.
Yeah, perfect.
That is a good idea. But thank you all for sticking with us tonight, and keep exercising. Thank you so much.
Thank you.
Thanks.
Thank you.